hey, this works. And if you don't believe me, look at this picture. And then I show them the deadlifts, and their mouths drop, including doctors.
Hi guys, this is another episode of Joint Effort. What's going on, Coach? How you doing?
I think you're doing excellent, Coach.
And today we got a very special guest. We have Frank Diliberto, and he was a member of our Knee Arthritis Recovery program, and he made it all the way from phase 1 to phase 4, where he's doing some deadlifting and all that good stuff that's in phase 4. And so he was just weeks out from knee replacement surgery, and he joined the program and then he canceled. So we'll go ahead and bring Mr. Frank on here and just let him introduce himself and talk a little bit more.
It's good to have you here, Frank.
Glad to be here.
So, Frank, so Jay was mentioning that you had joined the program, then canceled, then you came back, and ever since you started doing one-on-one coaching, you started working with Coach Jay here. So
Yes.
I kind of want you to talk to us about what was that first, I guess, month when you found out that you had arthritis, and then what were the things that led you up to coming on to our program and then eventually working with Coach Jay?
Yes. Well, actually, it started a long time ago. It was about 3 or 4 years ago that I had a major injury from tennis, because I was a tennis player most of my life. But anyway, I woke up one morning after an easy match and my knee just didn't work right. And this is going back 3 or 4 years ago, maybe even a little longer. So I just kind of nursed myself through that for a while, and it took quite a while, but I came back somewhat and I felt pretty good. And then about a year ago, January of 2025, it had progressed again, and it degenerated my right knee to the place where I actually was on a cane. I had the usual kind of aids that my wife had gotten for me for bathroom use, and just walking around, and I was miserable mentally because I had never had issues like that. And walking, of course, is something I didn't realize until that point how critical it was.
Yes, sir.
And yes, I had by that time already had 2 or 3 surgeons who wanted me to replace my knee after going through CT scans and CAT scans, X-rays, etc. So just by accident, I saw one of David's videos on YouTube, and I thought, well, this seems too easy, but I thought it was at first, although there was some truth that came through, because he just had a way of saying things that, for me, even though I was always skeptical of YouTube things, that sounded real. So I listened to a lot more, and it turns out that the simpleness of what he was talking about, and essentially what also impressed me is he was saying, no matter what age, no matter what stage you're in terms of the degeneration of your knee, even after x-rays and seeing you could be as far as bone on bone, if you follow these simple procedures, then my goal is to make sure you don't have a knee replaced if possible. So I just started doing those. I have a long driveway, and I just started walking down the driveway after listening to several videos and doing what he said about how to walk and how to squeeze your glutes.
Yes, sir.
And work easily on your feet. And I'd already had some instruction from other PT guys, because I've been working out most of my life in the gym with good trainers. And so I just did those basic exercises, and lo and behold, within days, there was less pain in my knees. And
Wow.
that was really shocking. So ultimately, I bought the first program and followed with all those wonderful videos that are on there that are very detailed, that both you guys are on,
Yes,
that demonstrate. But here's the big catch. I taught at many colleges, and what impressed me was, often when you teach something, it's haphazard. You say, well, do this or do that or do that. but everything was chronologically well organized,
Yes, sir.
and the videos were very well done, and it was such a professional looking situation, plus the comments and the clear videos from David, that I followed the program consistently. I worked with another PT trainer that I respect in the gym, who ultimately looked, because I said, look, I've been with you for a while. Can you just look at this? I know it's on YouTube, and I'm not trying to tell you your job, but you take a look at this. And she was, since that time, several months ago now, as Jay knows, she has been absolutely 100% on page with us,
That's incredible.
with your
man.
program,
Yes,
sir.
with your program, coupled with what she's doing.
Let me ask you this, Frank. So, how old are you? I want you to say it. I want it to come from
Sure.
your mouth.
I'm 82 and a half, and I feel so much better. I have other issues because I'm 82.
Yeah.
Nothing major, but I'm 82 and a half.
So I brag about you quite frequently. We both do.
Yep.
You are. I've got to say you're probably our shining star from the Knee Arthritis Recovery Program.
Well, that's very nice of you to say.
You know, our first session we had together, man, it almost brought me to tears. You're very close in age when my grandpa
Yes.
passed away. And so I
Yes.
kind of just clung to you, man. I was like, oh, this is cool. But I remember our first.
And I to you.
Yes. And I remember our first coaching call. You're like, Jay, I'm supposed to have surgery today.
Man.
July
And
15th.
yes.
July 15th.
I remember it clear as day. I was like, I had to stop. I was like, what? And you were like, yeah, Jay, I went ahead and canceled it. I'm all in. Here I am. I think at that point you were kind of already in phase 3, right? You had already worked up to the strengthening
That's right.
portion, but you showed up to every group coaching call. You asked questions. You were very on it in terms of like just understanding and digesting, the principles and the treatment options here with El Paso Manual Physical Therapy and Dr. David's principles. And I just thought that was awesome. And you just lit up the room. Those group coaching calls, I remember people would get off and we had one-on-ones and people would ask about you like, hey, what about that Frank guy? So I want to talk about the moment that really touched me because, I've seen my grandparents go through it, having construction done in their home to place like guardrails and, different, like you said, just to use the restroom, right? You have to have like a seat that's higher.
I had the
So
guardrails ordered.
let's talk a little bit about that because I remember you said that your son-in-law was going to come in and start placing all this stuff. So how did that feel to be able to call that off?
Well, it's like I said, at that point, I had become depressed about it all because I've been so active my whole life. I was a symphony orchestra musician playing for 60 years in great orchestras, and I played tennis and pool and golfed. I golfed a lot, quite a bit actually, and it just hit me how that I had always known because before that I had a guy that I worked with who has a clinic that specializes with helping elderly people. It's called progressive fitness, which is very significant.
Yeah.
Because nobody can get over these things overnight. It's gradual. Yes. But he had always said, if you lose your legs, you're in trouble.
Yes, sir.
So and he even used an example of what the old farmers used to do when they had just a scythe to work with.
Yeah.
When they're squatting half down all day long, cutting it, and all. So everything made sense. And when I got to the point where I needed those things, I thought, well, is this all over? And of course, I explained all the stuff about David and how that impressed me, and I got working on that. And the day I canceled it, and we talked, it was a glorious day. And I called my son-in-law and I said, hey, you've seen, because he visited a lot and he knew I was getting better.
Yes,
I was getting better. And he kind of knew all along that we were on the right path.
That's awesome. I remember that was like because everyone's different. Everyone comes into the program with different backgrounds. Some are sedentary, some are very active, like Frank here. And I just remember because I was the one that was kind of installing a lot of those safety precautions for my grandfather and my
Yes.
grandma. And I was like, man, you know, that's rough. I could just imagine. My grandfather played professional football for the Philadelphia Eagles.
Mhm.
And so I'm sure being a very active, healthy man all up until his 80s, he was like, man, you know, times are changing, things are changing. So for you to cancel that, I was just blown away. So I'm glad that happened. What was another good turning point for you in terms of like kind of getting out of that phase 3 into phase 4?
Well, clearly I saw I was progressing, but you know, it just seemed like everything I did when I didn't really have a lot of major setbacks, but every once in a while something would tweak a little bit and I would go immediately, even to this day, you know, I'll have worked out maybe a little too much. And for a while I was blaming it on the fact that I had a bad knee, even though I was, this is another thing about working with another trainer and also talking to you, is that you have all these little other parts of your anatomy in a knee, for example, that can be, you think it's the joint, but it's really just some other little thing so all of a sudden, all of that coaching started to make sense, and I eliminated a lot of worries that normally you would have.
Yep.
Think, you know, it could just be a little bit of a tendon that's a little sore, or this or that. It's not necessarily the joints imploding. But what I was going to say is, to this day, I'll notice that if I forget to walk correctly and I feel a little bit of a tiny, tiny twinge in my knee, it'll make me go back to squeezing those glutes with each step.
Yes,
and it goes away immediately. It goes away right now.
Yeah.
Oh,
Yeah,
that's
I feel
amazing.
that. I feel I'm using that muscle to step on the leg,
Yeah.
and it reaffirms my belief that, hey, this is what you have to do, and this is what works.
Yeah.
So, so I just can't, you know, praise the program enough. And I've had a lot of friends that have asked me, you know, and what I do is a lot of them I'll say, hey, this works, and if you don't believe me, look at this picture. And then I show them the deadlifts, and their mouths dry, including doctors.
Yeah.
I showed it to several doctors. And one was going to follow up on it. I asked him a couple times, and he said, yeah. He said, I've looked those things. So I don't know what else I can say other than the program works. If people are diligent about doing the daily exercises and not going overboard, that's the simple part.
Yeah.
In most cases, I can't believe that they won't be helped.
Yeah, I have a question for you, Frank. So leading up to you purchasing the program, do you have anyone close to you pushing you to get surgery?
I did have a couple. Yeah, my son-in-law, who's the son of a doctor. Well, you know, it's everybody, but and I had someone else. I even talked to 2 or 3 other people, and one was a physician who was my friend, for the closest friend, actually. He still is, for most of my life. And of course, the physicians take that path. You know, the physicians, especially surgeons, they want to cut, and PT people like yourself, they want to rehab.
Yes.
And so you know, I just really followed up. Again, here was another thing I did to answer you, Ralph, is I looked very extensively on follow-up with people, and there was a consistency that disturbed me, that made me again really want to follow the program as far as it would go and see if it could get me to a relatively healed knee, which it has. And that had to do with many of the people that had the surgery, even at the best, under the best circumstances, still had similar problems.
Yes.
After the surgery. The knee, I have a cousin who had who got the knee infected, very wealthy, a young lady, not young lady, she's my age, but a very wealthy lady that had a ton of money. She went to the best doctors in Chicago. They did her knee, and she got infected.
Oh man, yes, sir.
Fortunately, that did clear up over time. Good. And then about the repeat people that have to come back.
Yeah.
And I thought, hey, you know, if all of this is still a possibility to some degree or another, in terms of what happens after the surgery, I might as well stick with this program the best I can, because then if it fails, if it's all a bunch of hooey, I can always go to that, you know. And the other thing is, if you follow through and you get through to some success, you save yourself anywhere from 6 months to a year of recovery. And you're still going to have to go through all this.
Yep.
Yeah.
Yes.
Correct.
Yes.
Yeah.
So definitely, I'm glad you brought that up, because a lot of people just do look and say, hey, my wife wants me to have surgery, my husband, my kids, grandkids, they say I should just get it done. But I think Dr. David did something special here by fixing the root cause, the muscular imbalance, because just as you mentioned, Frank, even going through surgery, you still have to work on that imbalance. Yeah. So why not work on it first,
If I may interrupt, there's another reason too, is because it's, again, if you use your head and you don't just follow the program, I did see, I said, well, wait a minute, how many guys, in particular guys that I know, they don't have their butt anymore.
Yeah, correct.
There we go. Yeah.
And you're still using your quads because you got to go upstairs, and that was another thing that really improved. But anyway, so everything seemed to make sense about the muscle imbalance, all these other things. So I never got so many calls.
That's okay.
Go away. All right, it's gone. Really, it's funny how that works, huh? Every time I'm in the shower, that's when I get the call.
That's when they want to reach out and check in on us, man. Man,
So this is important. Well, I've been wanting to ask you this because when you started working with Coach Jay, I faintly remember that you had a bit of doubt in how you were gonna move from phase 3 to phase 4.
That's right.
So I really want to hear about how you bridged that gap, because what I've seen you do so far is you're deadlifting. Jay was showing me some videos. You're deadlifting now. You're doing deadlifts and you're doing weighted squats and everything else. So I'm looking at you and I'm like, what happened there? I mean, I knew that you were doing well, but I didn't know you were doing that well. So can you elaborate on what was your mindset?
Well, I had always been concerned because of doctors telling me, at this point in your life, when you're 75 or 80, you shouldn't be doing squats. All it's going to do is aggravate the knee. And I saw a lot of that stuff. So that was the one part that scared me a little bit. Everything else worked in terms of the knee feeling better, as I described in the initial stages of 1, 2, and 3. And when I was about to approach 4, that was in the back of my mind. And I remember talking to Jay about this. And he said, the baby squats really helped me take a chance.
Yes.
And saying to myself, okay, I'm not going to hurt this knee if I do this. And the other thing was form. This lady I'm worked with, and also asking Jay, when I started doing the baby squats and saw, hey, I could go down, and I kept my knees separated, and watched you, Raul, how you do the deadlifts and the squats, because I still have those on my phone. I go back to look. Yeah. And I guess that's called a specific kind of deadlift. But anyway, so I just took a chance, and I saw that as I did the baby squats, it wasn't too bad. And if I did it repetitively again and started with 10 and then do 20. And then I also noticed from the bridges that I was working those legs correctly. I thought, everything else has worked. Let's see if we can go. And you had encouraged me to just be careful. And if you feel a little pain, don't freak out.
Right.
So, so that's kind of how I got past it. And then the other part again was, I have this really wonderful young woman who's very, very knowledgeable and has, all the background that you should have in PT. She said, well, let's work together and start the deadlifts. And we just started with the bar.
Yeah, that's awesome.
Yes, sir.
Yes.
See? And she also put me in, what do you call that thing, Jay? Remember where you stand in it and you pull the whole thing up?
Yeah, the trap bar.
The trap bar.
Yeah.
That was where she started me, with the trap bar. And she said, let's just see if you can walk around and keep your balance with that. So that's how it started. And as I saw that was fine, now I got 50 pounds on that.
Oh my God.
So for me, that's huge,
Yes.
But I'm not pushing it. Right. So,
right.
And she emphasized the form.
Mm-hmm. Good job, man. Wow. Yeah, I was just curious because so if anyone looked at your progress and had the question in their mind, well, how much work did that take to go from phase 3 to phase 4? Like, what would you tell them?
It didn't take any more work. I mean, I do go to the
I
gym
love that. Yeah.
about
Yes.
3 times a week, and do other things. But in terms of, and I think it's all connected. So I do whether you're working on the upper part, but I'm diligent in keeping the lower part done, and it doesn't take me long at all.
Good.
I mean, the deadlifts, I try to do 2 to 3 times, and she's told me don't do any more than that.
Mhm.
Yeah. Mm-hmm.
2 to 3 times a week.
Yeah, that's more than enough. Yep.
Yeah. And if you feel any strain, she always asks me when I'm doing the deadlift, she said, okay, keep that back level, stick your butt out, make sure is there any pain in your back? No. Okay, well, we're on the right track.
Yes.
But it takes some courage to do those things. But most importantly, like anything else, as I've told you before, the only reason I mentioned I'm a symphony orchestra musician, when you get to the level of playing in these great orchestras, you must have had to work very, very, very hard.
Yes.
And it's a time consumption thing. And what you learn in any discipline is that everything takes time, and it takes commitment, and it takes consistent work. There's no getting around it. I don't care what profession you're in. If you don't follow those kind of basic rules of being consistent and working hard and staying diligent and having some confidence in yourself, it's not going. You're just not going to succeed.
That's funny you say that, man. So when Raul and I started powerlifting together 14 years ago now,
Wow.
that was one thing, it just started off as like following a program.
Yeah.
Okay.
Yeah.
But then we got to college, and we realized like how having that structure and confidence helped us to get through the grueling parts of studying and learning and taking tests and taking quiz. And we just realized how resilient like following something made us, because now we're both married men. I have a kid, and I still follow that same structure, right? You have like your phase where you're accumulating volume, right? You're learning, you're understanding, you're applying some things, and then you get to your strength phase where things are tough, things are hard, not everything's easy, but for some reason you're able to keep going. And then you get to that testing phase where you're like, oh, yeah, like I'm doing it. And so for you, that was like, offloading, doing the easy stuff, the glute squeezes, and then transitioning into the mini squats and into the glute bridges. And then, of course, going into the gym where you're just lifting a barbell at 82 years old. Yeah, that's incredible, Frank.
You talk about your grandfather, and I talk about my father, who was a poor Sicilian, and he loved music. He used to listen to opera, and I don't think he had more of a fifth grade education, but he worked like a dog his whole life.
Yep.
And he was a very smart man. And one of the things that was a turning point to me in music, which is applicable what we're talking about, being consistent and working at something diligently, is, he started giving me accordion lessons when I was 4 years old at a really great teacher. And by the time I was 10 or 12, after he bugged me about practicing and all this sort of stuff. And of course, like anything else, after a while, especially to young people, you start practicing after a while, you want to go play baseball or do something else, right? So I got to a certain point, because he was pretty hard on me about practicing every day, just a half hour or whatever. And I remember now I've got 6 or 7 years behind me of playing the accordion, and pretty darn good. I was the accordion state champ at 16 in Illinois.
Oh, there you go.
So at 10 or 12, I was getting really lazy about my practice.
Yeah.
This also happened in college later on when I became a professional player with the teacher I had then. Same thing happened. But anyway, my point is, he said, okay, I'm tired of bugging you. He said, I want you to quit. I'm tired of bugging you. You give up. Well, I had so much invested at that point.
Yeah.
When I knew he meant it, I said, well, wait a minute. This is my identity. I'm not going to give this up.
There you go.
There you go. Yes, sir. Yeah. That's funny, Frank. Yeah. That ties in. So Raul and myself are both musicians as well. And so that is truly a labor of love. You have to, man, I've been playing drums for 26 years now, and I'm still learning. I'm still growing. I can do it in my sleep. I can do it with my eyes closed, but I still have to practice. Yeah. But I love that you mentioned that, because I think it ties into the people that do join the program, and they're in phase 1, they're in phase 2. Yeah. And it comes to the point where they're looking to us like, save me, but it's like, we're trying. We're giving
Yeah.
you everything you need to excel.
Yeah.
But it does take a little bit of gumption. It takes a little bit of grit. And you got to fight for it. So it does come to that point where we kind of have to, hey, it's up to you. You know, and I love that your father did that to you, man.
That's a very good point because I had a student that became a professional player, and I remember at a certain point halfway through his education with me, come in for private lesson, he said to me, okay, Frank, what are you going to teach me today? And I kind of got angry with him.
Yeah.
And I said, what do you mean? You've been coming with me for 5 years. I've given you all the tools that are necessary for you to improve, and it's about time that you start figuring stuff out based on that on your own.
Yeah,
you know what I mean?
Yes, sir. Yes, sir.
Yeah.
So,
wow.
Well, you guys are amazing, and I can't praise you enough for what you do, the commitment to it, how much you enjoy working with your patients, and it's just been terrific path for me.
Thank you, Frank.
Thank you, Frank.
We appreciate you so much for coming on. One of the main reasons why we wanted to talk to you because there's a lot of people that need to see or need to hear about someone who already did it, already is doing the thing. And it's important to also know how many hours you have to put into this type of thing to fix it.
Yes.
So I just want someone to watch this video, either YouTube or like if you're on YouTube watching this, or if you're a part of the community, to take a look at Frank and just kind of listen closely to how long this took him to resolve and how much work he actually put into it. It's like anything, right? It's something worth doing, but anything worth doing takes a lot of work.
Yes.
Yes.
Yeah.
Yes. Well, you know, like our parents, I'm sure yours too said, if you don't have your health, you don't have anything.
Exactly. Yes.
That's very true. You know, you can't sustain a life, or you can't take care of a family if you're not taking care of yourself. So I love that you said that, because it does come back to what are you willing to do for yourself?
Yeah.
Right.
And in turn, you taking care of you helps you to continue taking care of your loved ones.
Yeah.
So that's a great point, Frank.
You know, another thing for elderly people like myself is if you don't want to be a burden on people around you either.
Yes, sir.
So it's almost something that you should do.
Yeah.
Not even necessarily for yourself, but because, I won't get gross about it, but I don't want people having to take care of me when there's something I could have done to prevent that and not belabor them.
Yes, sir.
Sir. So there's a lot to this, and again, I thank you.
We thank you.
And anything I can do, any little tidbit I can help you guys with at any time, feel free to let me know.
Thank you, Frank. We really appreciate you, and thank you for coming on today's episode of Joint Effort, and just being such a great light of inspiration.
Thank you.
And I don't know, man. It still inspires me. It makes me want to be better at my job here. I care. I'm very passionate, but it makes me want to help more people. And I think this episode is going to help a lot of people that are still on the fence of like, is this going to work for me? Hey, if Frank at 82 years old is deadlifting 3 times a week, I think that this is definitely worth giving it a shot.
My wife's over there shaking her head because she says, why do you keep telling everybody you're 82?
Well, Miss Judy, age ain't nothing but a number, but it is important.
Yeah.
And
did you hear what she said?
Yes, sir. Repeat it on the camera if you like, sir.
Can you believe we're married 57 years?
Oh man. Hey, that's
it's because of her, actually.
Behind every good man is a better woman.
Yeah.
So
yeah. Shout out to Mr. Diliberto.
Yes, and we're right there with you. Don't worry, I got my handler at home too, man.
Same here.
Well, Mr. Frank, thank you so much for just coming and joining us. We really appreciate you, man. And again, just thank you for offering some insight through your journey in the Knee Arthritis Recovery Program, and just sharing your awesome story with us. I feel like this episode could be 2 hours long, but I'll let you get back to your day. I know Ms. Judy probably called you and wondering why you didn't answer your phone, man. So
I'm gonna see you in about a week anyway.
Okay, I look forward to it, my man. And like I said, if you ever need anything from us, please feel free to reach out.
Okay, Raul, good talking to you too.
So a great conversation there, Mr. Frank Diliberto, who is one of the all-stars of the Knee Arthritis Recovery Program.
Yeah.
As you heard, he started off with just joining the program on a whim, randomly. So shout out to Dr. David
Yeah,
and filming
seriously.
and our media team for all the amazing videos that they put up for free on
Yeah.
our YouTube channel. So that way people like Frank can get on. And I don't know, that's just still very touching. I don't want to start crying on y'all in here, but man, it's great to just hear. I don't at any age
Yeah, at any
that
age,
that
yeah.
people get their freedom back and they're able to just enjoy living life. And he plays pool. I think he says he plays he has a basement full of his own table and everything, but he's on a competitive team with his wife.
Yeah.
And they're doing competitions on a weekly basis, and then he's going to the gym 3 to 4 times a week. He didn't have to put any guardrails or extra adjustments on his toilet just to get in and out of the restroom comfortably. And to me, that is what it's all about. Like the hiking, the pickleball, all of that stuff is cool to get back to, but just being able to live day-to-day life is it's priceless, man.
Yeah. So for anyone listening today, the thing that resonates the most with us as coaches is that Frank wanted it just as bad as we did, and that's important because oftentimes you have people that you talk to and they already signed up for this program. They already signed up for coaching, and then they show up to the call expecting to be convinced to do the thing. That's fine, but I want you to feel this as almost a little bit of a kick in the butt to say, man, if this gentleman who's 82 years old took his life back and he's doing so well, then so can you.
Yeah.
So please consider this as an invitation to do more repetitions and get stronger.
Yeah. So thank you guys for tuning in. We'll see you next time.
See you the next one. Bye-bye.